This is Dr. Lindsay Van Dyke, and today I want to talk to you about hypoglycemia, or as it's otherwise known, low blood sugar. Before we get to hypoglycemia, let's talk about how sugar is normally used in the body. When you consume carbohydrates, and carbohydrates are things like bread, rice, pasta, fruit, juices, sugar, or other sweets, enzymes in the mouth, stomach, and pancreas break it down into its most basic part, which is glucose, or sugar. The cells in our body will take in glucose either directly or most frequently with the help of insulin that is secreted by the pancreas. When the body is hungry, insulin is barely made at all. When the body has just been fed, insulin production is high to help your cells use the glucose you just took in. People who do not have diabetes can tolerate blood sugar levels that go quite low. Women especially are evolved to handle blood sugars even as low as 35. All of the processes involved in normal glucose action are extremely well regulated, and this makes the process of diagnosing hypoglycemic states kind of tough. Before we go on, let's talk about what do normal blood sugars look like. Well, if we were drawing blood from your vein, we would expect when you're fasting for the glucose to be under 100, and in most people this looks something like 70 to 90. Similarly, if you eat a meal, we would expect that 2 hours later, that blood would show the glucose level under 140. For people who track their hemoglobin A1Cs, which is a 3-month marker of how much blood sugar we have, we would expect a normal one to be under 5.7. Just for reference, a diabetes diagnosis begins at a hemoglobin A1C of 6.5. So what happens to us during a hypoglycemic event? As blood sugar falls, insulin production slows down, and a different hormone takes its place. That hormone is called glucagon, and it is also made in the pancreas, but it's made in a different type of cell than the ones that make insulin. Glucagon makes the body use its backup supplies of sugar, which are called glycogen, that's stored in the liver and the muscles. The body notices a drop in blood sugar, and that's how you quote-unquote feel hungry. If blood sugar continues to fall, the body will feel more symptoms. Those symptoms are rapid heart rate, sweating, anxiety, shakiness, confusion, and in severe cases, it's possible to faint. Where do these symptoms come from? Well, the lower the blood sugar, the more emergent the situation. And what happens in an emergency? Fight or flight. That's right. Epinephrine and cortisol are what cause these other symptoms. But what causes hypoglycemia? Well, the problem as a doctor is that there are many causes of hypoglycemia. Sometimes there's just interference in the lab test, and that's a term we call artifactual hypoglycemia. Certain illnesses can give us low blood sugars, certainly severe infections like sepsis that you would be hospitalized for, or chronic diseases like diabetes, and many others. Moreover, some of the medications we use to treat any of these things can cause low blood sugar. In fact, we have a lot of data from many publications that show that there are about 175 different types of prescriptions that can cause low blood sugar, and that's everything from antibiotics to blood pressure medications. So this becomes a real sticky situation for patients who are on a lot of meds. Alcohol can cause low blood sugar in large quantities because it can block the body's ability to restock its glucose stores, that glycogen that we keep in the liver and the muscles. Malnourishment can cause hypoglycemia. That's what we see in people who have been severely starved, or they have deficiencies in certain mechanisms for the body to absorb nutrients from the gut. Sometimes bariatric surgery for weight loss will cause a malabsorptive state, and we would expect to see low blood sugar in some of those people. One of the very serious mechanisms for low blood sugar is also low cortisol. This is pretty serious because the body must have cortisol in order to live. In fact, there are 3 hormones you absolutely cannot go without. Cortisol is the first, insulin is the second, and the third is your thyroid hormone. Speaking of insulin, excess insulin can cause low blood sugar, and that has many different forms. First of all, patients who are receiving injections of insulin, even if the body doesn't need that, they definitely experience low blood sugar. There are certain types of pancreatic tumors that make extra insulin, when they're not supposed to, and these tumors are extremely rare. Sometimes, especially in patients who were very obese and then they had bariatric surgery to lose weight, they can have overactive pancreas cells that make more insulin than they should, and that's pretty tough to treat. It usually involves more surgery. Of course, there are autoimmune causes, as there seem to be with everything, and this would involve a patient making antibodies to insulin or to the receptors on the cells for insulin, because if the antibodies are messing with them, sometimes the insulin can go crazy. So when a patient is sent to me for suspicion of hypoglycemia, I have to walk through a number of complex steps in order to prove that this is true. How do we diagnose the cause of hypoglycemia? Having a low blood sugar by itself just isn't enough. And here I want to introduce you to the concept of the Whipple's Triad. This is a fancy term for saying that a patient has to have symptoms of low blood sugar that go along with a blood sample that demonstrates low blood sugar in the lab, and we have to prove that the patient feels better when we use a standard glucose rescue. It's really important to identify when blood sugar becomes low. Is it low when the patient is fasting? Is it low after a meal? Is it low both of those times? If a person only has low blood sugar after eating, it might be a normal reaction, or it might require a mixed meal test to try and prove a low blood sugar. If you go back to our discussion about how women are extremely well evolved to tolerate low blood sugars, that's what I mean by having a normal reaction. If you eat a big carb load, you have a big insulin load, and then you can have a low blood sugar later. And so the key to that would be reducing the size of the meals, reducing the carbohydrate intake, and eating more frequently in smaller bouts. If a person has low blood sugar when fasting, diagnosis usually requires that they be admitted to the hospital for a 72-hour diagnostic fast. How do those work? Well, it starts at home the night before because we try to minimize the amount of time in the hospital. So at about 6 p.m. the night before we get started, the patient has their usual light dinner, and then afterward do not eat or drink anything except for water. The following morning, the patient comes into the hospital and we do some blood tests at their baseline. We want to know metabolic panel, fasting sugar, all of that stuff. We restrict the diet to just water. They remain in the hospital for a total of 72 hours. They do their best to go about their daily activities, and we check those blood sugars by finger stick every 2 to 4 hours. If at any time the patient feels like his or her symptoms of low blood sugar are coming on, we do another finger stick to check. If that number is less than 60, the patient's blood is drawn to confirm that. A low blood sugar is confirmed when the level is less than 55. Once we've proven it's genuinely low, we draw all these other labs immediately. We check for things like the amount of insulin, the amount of C-peptide, and that's secreted with insulin. We want to know if they have any other medications in their system that might be causing the low blood sugar, etc., etc. After those labs are complete, we give the patient a glucose rescue, and he or she can begin eating again. So once that lab data comes back, we look at it to determine if the patient has excess insulin in the bloodstream when they have low blood sugar. So, what happens when a diagnostic fast is positive? Well, it feels like a victory, but it's actually just the beginning, because at that point, we know there's excess insulin when there shouldn't be. And we know that we've ruled out other causes like medication interference and so on. So then the patient requires an ultrasound or a CAT scan to look for a tumor that is making that extra insulin where it doesn't belong. Sometimes these things are tiny, sometimes they're very hard to find, and if we can't find it on the first scan, but we're really, really strongly suspicious that it's there, we'll have to do an ultrasound that's done through an endoscope. So just like you go into your GI doctor for an endoscopy or an upper GI and a lower GI, we do the same kind of thing, but while they're in there, they're using an ultrasound to look through the stomach to see if the tumor is pressing up against it. If we can prove that there's a tumor there, then we can remove it by surgery, or we can use a process called enucleation, which is kind of like suffocating the tumor so it dies. Let's go over that mixed meal test. It's not that different in principle from the diagnostic fast, except that instead of starving somebody for 72 hours, the patient is given a prescribed meal, especially one that they know is going to produce the low blood sugar in question. After eating, we wait for the onset of symptoms. When those symptoms begin, we follow the same procedure that we described earlier for the diagnostic fast, with the finger stick, confirming it with a blood draw, doing all of the important labs, and then rescuing the patient. So I think after this discussion, we can all appreciate that hypoglycemia can be an extremely complex problem, or it can be a subtle variation on normal physiology. And so if you want to learn more about hypoglycemia, a good place to start is the Mayo Clinic. So you can go to mayoclinic.org and search for their section on hypoglycemia, or even to webmd.com and search their section on non-diabetic hypoglycemia. The University of Michigan also offers an interesting site about this problem, so you can check out uofmhealth.org for more information.